If you have POTS, postural orthostatic tachycardia syndrome, this video is for you. It is geared a little bit more toward individuals that have hypovolemic POTS, so tend to have lower blood pressure rather than hyperadrenergic or neuropathic POTS. But if you have the other two types, then you're likely still going to get some benefit from what I have to say. I'm a naturopathic doctor. I help people get optimally healthy for a living. I work with lots of different POTS patients. I experience POTS myself. I used to fit all of the criteria, and now I no longer do, so I consider myself healed. I now help lots of different individuals that have POTS heal themselves. And these are some of the basic things that I go through with all of my individual patients on a regular basis. Hopefully you'll get some value. First things first is getting quality labs done. You probably get the CBC, the CMP, urinalysis, make sure your blood sugar is good, and maybe not get some of these other individual labs. So let's go through them. One, hormone testing, especially in women. I'm yet to see a female POTS patient that doesn't have low progesterone or at least suboptimal progesterone. Very, very common for me to see, or sometimes I will see significant estrogen dominance, but slightly normal progesterone. So then there's going to be an imbalance there that's then affecting symptoms, and many times having more symptoms right before menstrual cycle or during the menstrual cycle. If that sounds like you probably should get these hormone levels tested. Men can also experience hormonal imbalances. Many times we see lower testosterone levels, lower DHEAS, and sometimes we might see higher levels of estrogen than we necessarily would be expecting. So hormone labs would be definitely something to get done if you have POTS. Other things to investigate would be getting an iron panel done. If you just do a CBC with your doctor, it will tell us if you have anemia or not, but it won't tell us if you have iron deficiency necessarily. Really important to get a full iron panel with ferritin to make sure that you're not having low iron without anemia, and potentially that's actually driving your POTS patients. I see that more often than I would like to say. Next thing would be getting quality B vitamin testing. So if you go into PubMed, you'll see all of these research articles on this, but if you're not interested in that nerdy sort of thing, you can just make sure that your doctor tests this for you. But thiamine has very similar symptoms and deficiency to POTS. So many times if you have low thiamine or thiamine deficiency, then many times you can have POTS-like symptoms. So really important that that is tested on your blood work as well. So good hormone testing, iron panel testing, making sure that you have good B vitamin testing. And of course, there's going to be other labs that as an individual you should get done. Like if your doctor thinks that you have Epstein-Barr virus, cytomegalovirus, Lyme disease, etc. There's definitely different other things that should be done, but in terms of the basics, run through that list, make sure you've had that investigated. Other things that I commonly talk to my hypovolemic POTS patients about include adequate hydration and electrolyte balance. I think most POTS patients have heard this, but are they as diligent as they should be? I don't know. Maybe you are very diligent about it, or maybe you're not diligent at it at all, or maybe you've never heard of this before. But many times in hypovolemic POTS, lower blood pressure, you benefit from having a higher salt intake. And that includes taking electrolytes on a regular basis. Some people get enough benefit just from salting their food more. Your doctor, whether it's a cardiologist, neurologist, primary care, or naturopathic doctor, should be advising you on the exact amount to be consuming. So definitely talk to them about that so you can get exact recommendations for you. I commonly refer my patients to Element, LMNT, the plain version, not the flavored. The flavored versions have flavor additives in them and stevia, which often aggravates people. I'm sorry to say it, but it's the truth. Or I also recommend salt sticks. I'm not sponsored by any of these things, just want to make sure that you get help. But salt sticks, there's a product called Vitasium that was particularly formulated for POTS patients, which is phenomenal. Third major thing I commonly talk to my POTS patients first early on is using their compression stockings if they tend to have low blood pressure. I know it can be annoying to put these on every single day, but if you're super symptomatic and you're having syncopal episodes like passing out all of the time or almost passing out all the time, blood pressures are super low, super symptomatic, you need to do everything that you can in the beginning to mitigate as many symptoms as possible. Even if it helps by 1%, that's a pretty big deal in the grand scheme of things, because if your progesterone's low, your salt intake's low, you have iron deficiency, you have thiamine deficiency, and your blood volume is low as a consequence of some of these factors, and then we add in compression stockings to at least help you with 1 or 2 or 3% in terms of how reactive your body is, that actually is a pretty big deal. Over time, gives us space to help you feel better, slowly, incrementally, until we create significant positive change. There's much more that I could say, but I'm trying to keep this under 5 minutes. Again, I'm Dr. Williams. I'm a naturopathic doctor. I used to have POTS diagnosis, no longer have it anymore. Healing is possible. I just want you to know that is the case. Please make sure that you ask your doctor about all of these lab work, get these things assessed, work on all of these things. You can do it. Bye.